How can you avoid losing muscle and bone as the years go by? Can you reach 85 in good physical shape? What elements do you need to modify in your diet? What type of exercise do you need to start doing? When should you start doing it? We are a fragile society, increasingly so, and we have to accept it if we want to improve. Fragile is not just an adjective, it's not just the definition of weak that can easily deteriorate. No, it's a well-defined clinical term that refers to a very dangerous situation. A situation that brings you closer to illness and to not being able to fend for yourself. Your physiology is governed by an unmovable and unavoidable principle. Use it or lose it. We don't stop moving because we age because we stop moving. In this video with almost 2 million views, we explain how to avoid the loss of muscle mass associated with age. Today, we discuss a more complex but related topic to sarcopenia, which you're already familiar with. We'll go one step further and explore how to avoid muscle and bone loss and excessive fat accumulation. You might wonder, are these three tissues connected? Muscle, bone, and fat. How are they related to each other? You're about to find out. The most direct way to explain it would be that excess fat deteriorates the bone and muscle. This leads to a potentially fatal condition called osteosarcopenic obesity. It is the most advanced state in the deterioration of a human being's body composition, and it brings you closer to death. I repeat, it is the worst body composition you can ever have in your life. If this name intimidates you, osteosarcopenic obesity, remember it as little bone, weak muscles, and excess fat. Do you know someone like this? Today you're going to learn how to stay away from this condition. I promise you that this new normal, frailty, is not your destiny. Neither obesity, nor sarcopenia, nor osteoporosis are your destiny. You can save yourself from them if you are willing to invest time, energy, and focus on meeting the points I leave you at the end of the video. How did we get here without realizing it? Until now, we have considered weak muscle, brittle bone, and excess fat as separate entities with separate and stagnant diagnoses. But this is a mistake. They are totally interconnected. We might think that adipose tissue, as we gain fat, only expands, increases in size. You eat and it gets bigger, that's it. But not only that happens, it also gets sick, changes its quantity, but also its quality. As they have to accumulate more fat, the adipocytes hypertrophy, increase in size, generating more and more stress in the cell. It's as if they're about to burst, squeezed together. The fat cell is drowning in fat precisely, and it doesn't function well. This generates within these cells inflammatory signals called adipokines and a recruitment of immune cells, which are going to see what's happening there. Mainly M1 macrophages. Over time, the immune system generates inflammation, first local of the adipose tissue and then of the rest of the tissues, that is systemic, and also a migration of fat to other organs, such as bone or muscle. No more fat can be stored in the adipose tissue, and it releases fatty acids that migrate abroad, generating dangerous fat. If you remember, the most dangerous fat is the one that surrounds your viscera and also the fat that infiltrate the viscera, visceral, and ectopic fat. So far, we have an excessive accumulation of fat, sick and inflamed fat, and the spillage of fat towards viscera and other tissues. When we talk about visceral and ectopic fat, everyone thinks about fatty liver, fat that goes to the liver. But no one thinks about the bone and muscle. And just that migration of fat also affects these two organs and affects them a lot. Why does excess fat deteriorate the bone? Let's talk about fatty bone. First, in sick fat, molecules called microRNAs are produced that are wrapped in vesicles and exported to the bone. There, some of these extracellular molecules inhibit the formation of new bone and promote its resorption, its elimination, increasing the osteoclasts, which are cells that eat away at the bone. But not only that, these abnormal signals that fat gives to the bone generate expansion of adipose tissue within the bone marrow. They increase fat cells while forming less and less bone. This alters the bone microarchitecture, greatly increases bone fragility, and impairs immune function. Blood cells originate in the bone marrow. In the muscle, something similar happens. Excess fat deteriorates the muscle by infiltrating it, causing a fatty muscle. A muscle excessively infiltrated with fat loses the ability to send healthy signals when it contracts. If you remember, the muscle when contracting generated signals called myokines or exerkines which reach other organs, but it also loses the ability to receive healthy signals from bone and fat. This communication between the three organs is totally altered and all three lose out. Finally, this excessive infiltration of abnormal fat contributes to what is known as dynapenia or loss of strength. So we have a large number of people out there who combine obesity, osteopenia or osteoporosis, sarcopenia, and dynapenia. Therefore, many researchers found themselves in the need to create an entity that explained these three alterations and their consequences. Thus, Osteosarcopenic obesity was born. In 2014, Illich and collaborators first established the term osteosarcopenic obesity. How common is obesity really? Dr. Borja Banderas suggests drawing your own conclusions. Over 25% of people aged 50-54 are obese. When considering excess fat, including overweight, more than 50% of the population has it. Osteoporosis affects 23% of women and 12% of men. The overall prevalence of sarcopenia is estimated at 10%, although these data are often greatly underestimated. Recent studies suggest that at least 10% of the population meets the criteria for osteosarcopenic obesity. That is, in the most optimistic of scenarios, 1 in 10 people around you has a depleted bone, low muscle mass, and reduced strength. The worst part, osteosarcopenic obesity doesn't hurt. We can get very old by overlooking it. We live completely ignoring our physical dimension. We are consumed by worries, responsibilities, economic struggles, and lost in pleasure. Our tech-driven society makes it harder to break free from a sedentary lifestyle. We don't realize we're doing anything wrong or missing something since everyone is the same. We mistakenly believe that having a robust body is no longer crucial for survival. As a result, we become fragile, leading to secondary consequences that significantly diminish our quality of life, such as social isolation, anxiety, disability, depression, low economic status, polypharmacy, and becoming a burden to family, society, health systems, and the state. Let's talk about the solutions. How to avoid muscle and bone decline. Avoid the fragility of the elderly. The first point is conceptual in essence, and we are all responsible for carrying it out, no matter how old we are. Our Western society, unlike more traditional societies and hunter-gatherer societies, has ignored the social role that the elderly play. We assume that anyone over 65 or 70 is inherently fragile, doesn't need to maintain their physical health, and lacks important family or social roles. Making our elders fragile will only execute a self-fulfilling prophecy. My recommendation is, as long as you're alive, live. Live to the fullest. If you trained at 30 to be well, you should train at 75. The decline does not start at a certain age, it starts when you stop using systems in your body. The musculoskeletal system and the central nervous system are the two central systems that you need to keep active daily. There is no age at which you have to lower your arms and say, up to here, I'm tired of fighting, I'm tired. Getting tired of fighting is getting tired of living. Life is struggle, living is not sitting around waiting for your time to come. Mechanical stimulus. The only non-negotiable point is this. You have to generate a mechanical stimulus with enough intensity and frequency. Why? To preserve the muscle and bone. The language in which the muscle and bone speak is that mechanical stimulus. It's the way they have of feeling what's happening around them in the environment. This involves training muscle strength, choosing multi-joint exercises, ideally performed at the maximum intentional speed of movement in the concentric phase, and doing them on a daily or almost daily basis. Just like you brush your teeth every day, you train every day or almost every day. This will preserve the fast fibers, which are the first to be lost over time. Floor push-ups, dumbbell rowing, pull-ups, well-executed squats, lunges, shoulder press. Start as soon as possible. Your lowest point of bone and muscle mass depends on the peak of bone and muscle mass you achieve during your young years. Someone who trains from their 20s will reach a considerably higher peak than someone who starts training at 50. When the decline begins, the first will end up with more muscle and bone than the second. It's obvious, right? However, any time is a good time to start. You can build muscle at any age and also in your 70s and 80s. Start now because tomorrow is late. This concept of peak bone and muscle mass is especially important in women. Menorrhagia, for whatever reason it occurs during the young years, makes this peak of bone mass much lower and makes you susceptible to osteopenia and osteoporosis later. Hormonal optimization. Osteosarcopenic obesity is more common in women because the drop in hormone levels is more abrupt in you from menopause. And menopause occurs relatively early in a woman's life. Both estrogen and testosterone have a protective role on muscle and bone and decline a lot in menopause. Let's not forget about testosterone. The functional decline is usually associated with a hormonal decline, less sexual hormones more quickly. You lose muscle, and bone medicine is increasingly looking towards the artificial support of an appropriate hormonal environment. To avoid these problems, one should ask a question if the benefit-risk ratio is favorable. Now, would you prefer to keep your sexual hormones in a normal and healthy range until the end of your life? This can technically be done today. It has been able to be done for a long time, in fact. Anti-inflammatory diet. There is a factor that we have not mentioned and that accelerates the loss of muscle and bone. It's chronic inflammation. This cannot be solved only with diet. But undoubtedly, diet is a fundamental point. By anti-inflammatory diet, we mean something very simple. A dietary pattern that excludes pro-inflammatory elements and adds foods with special anti-inflammatory power. By this point in the movie, you know to eliminate ultra-processed foods, fried foods, simple sugars, refined carbs, processed meats, alcohol, excess sodium, and for sensitive people, gluten and dairy. While controversial, I advocate removing artificial sweeteners to reduce inflammation as much as possible. As for foods to include, fruits and vegetables with emphasis on cruciferous green tea, pure cocoa, nuts, legumes, probiotics, and foods rich in omega-3, especially blue fish. Let's not forget extra virgin olive oil and spices like turmeric and ginger. To prevent osteosarcopenic obesity, it's crucial to have adequate intake of 4 micronutrients: vitamin D, calcium, magnesium, and vitamin K. This can be achieved through diet or supplementation. Vitamin D3 with magnesium and K2 is almost always included in my supplementation regimen. Adequate consumption of macronutrients and energy. Don't forget about macronutrients. The most important by far is protein. Choose quality protein sources and reach at least 1.6 grams per kilogram of weight per day. This change will help preserve muscle, bone, but also importantly, keep fat mass at bay. As for carbohydrates and energy, there is a significant contradiction that requires a difficult balance to achieve. On one hand, greatly restricting carbohydrates and energy, that is calories, helps to lose fat mass, but on the other, it significantly deteriorates the bone. When there is no training, muscle tissue deteriorates. That's why it's crucial to train and stay active. This allows for sufficient energy and carbohydrate intake to maintain muscle and bone health without significantly increasing body fat percentage. Avoid polypharmacy, as taking more drugs increases the risk of osteosarcopenic obesity. For example, long-term use of corticosteroids directly causes osteoporosis and sarcopenia, while proton pump inhibitors can reduce calcium absorption. Benzodiazepines and some antidepressants can cause drowsiness and a more sedentary behavior. There is cumulative toxicity and dangerous interactions. For these and other reasons, a periodic re-evaluation of the need to take the drugs you are taking should be done. Are they necessary? Is the benefit-risk balance still positive? Can I reduce the dose or eliminate some without harming my health? Now you know how to defend yourself from this threat, osteosarcopenic obesity. See you in the next video. A big hug and keep empowering.